Hello there. Welcome to GrowMed. This channel is a one-stop guide for the Fmge aspirants. We will be discussing everything you must know for the Fmge, the mnemonics, the important points, then the previous year questions, everything. Subscribe to GrowMed and tap the bell icon so that you do not miss a regular study tip. So in this video, we will be looking at the must-do topics from the surgery. Do watch the video of the must-do topic from the other subjects that are already posted on my YouTube. So the list of the must-do topic is important because it will help you to be organized and also time saving, and also you will be able to cover all the important topics. So let's get started. So the first and the very important question is the ATLS protocol, which is from the trauma. So the trauma assessment is a must-do topic, and every year 2 or 3 questions are asked from this. So let's see what all you must cover in this ATLS protocol. So as you all know that it is the primary survey and it includes A, B, C, D, E, that is A for the airway, then B for the breathing, circulation, disability and the exposure. The step-by-step procedure and the findings which you must know, which you must see in this, you need to look at all those points. Like for example, in the airway, you will be looking at the airway of the person, and if it is not normal, then you will be securing the airway, and you will usually do it by endotracheal tube. And if there is maxillofacial trauma, then you will be doing it using needle cricothyrotomy or tracheostomy. Okay, so you need to look at the indications of the endotracheal tube intubation and the definitive management. How do we do it? Then the second one, the breathing. In this, you need to look at the parameters like the ventilation and the oxygenation. Then also management of the conditions like the pneumothorax, if there is tension pneumothorax, and if there is massive hemothorax and severe pulmonary contusion, how do you treat the patient? Then next you need to look at the circulation of the patient, whether it is normal or if the patient is in shock. And if the patient is in the shock, you need to look at the type of the shock and treat him accordingly. Then in the disability, we will be looking at the GCS score, which is the Glasgow Coma Scale, and in this we will be looking at the 3 parameters that is the eye opening, then the motor response and the verbal response, and we will be giving points according to it. So this Glasgow Coma Scale, it is a must-do topic and you need to by heart the whole table. Then the 5th parameter, it is the exposure, in which you will be doing the following things like prevent hypothermia, keep the patient warm, give the patient IV fluids. I will try to upload a detailed video on this ATLS protocol as it is very important and you cannot miss this topic. So do watch that video also. Then the next topic, the shock. So shock also every year one question is asked, so you can expect a question in the future exams also. So the question is asked on the class of the shock and the types of the shock, like the hypovolemic, hemorrhagic, septic shock. And the questions are asked on the management, like you need to give the fluids and what amount of fluid you will be giving and which type of fluid you will be giving, like the crystalloid or the colloid, and at what duration of time you will be providing the fluids. So all this is important as question can be asked like a clinical case, providing some features of the shock and ask you the management. Then some one-liners asked from the shock, like the best parameter to assess the tissue perfusion, and it is the urine output, and urine output how much it should be in the adult and in the children. Like in the adult it is 1 ml per minute and in children 0.5 to 1 ml per minute. And in the shock, another very important thing you must cover is the cannula size and the color coding. The cannulas and the size and their color. Okay, so like for example, the orange and its size is 14 gauge and its flow is 240 ml per minute, and it is usually used for the trauma. And the other colors like the gray, green, pink, its size and its uses. So you need to look at all those points. And also look at the images, because image based questions are most likely to be asked on this topic. So next, moving on to another very important topic, that is the brain hemorrhage. And without the brain hemorrhage question coming in the Fmge, the paper cannot be set. Okay, so it is a must do topic. You can mark it as a 5-star, and the format of the question can be image based, simple one liner, or clinical case, or in the case of the management, or all except kind of question. So you cannot miss this topic for the Fmge. I have already uploaded a video on the brain hemorrhage in which I have completely explained which points you must know along with the images, so do watch that video also. Then the next topic is the burns. So in the burns, the question are asked on the classification, that is the superficial, the deep, then first degree burn, second degree burn. Okay, that, and you need to also look at the management of the burns, the very important formula, that is the Park gland formula. So question can be asked describing a case and giving the amount of fluid loss and amount of burns present, the age, the weight, everything, and you need to calculate how much fluid you will be giving the patient by using the Parkland formula. So do look at the formula and also practice 4-5 questions on how to calculate the fluids. Then along with that, question can be asked one liners on the burns, like the fluid of choice, which is the ringer lactate, then the most common cause of death, the most common cause of early death. So these were some points which you must cover from the burns. Now moving on to another very important topic, that is the pneumothorax management. And I have seen this question in every paper of the FMG, like each and every paper. So by heart, the management of the pneumothorax, everything, like the image, then the management, the chest x-ray, the case, if they give a case, then in which pattern the case can be described, everything about the pneumothorax, especially on the management, that is the intercostal drainage in the fifth intercostal space. Then moving on to some vascular disorders like the birth chest disease. So vascular surgery is also important because 1 or 2 questions can be asked from the vascular surgery. This birth chest disease, which is also called as thrombosis obliterans. So look at the clinical features, and if they give a case, in what manner the case can be described. So if the in the clinical case, they usually give the hands. Okay, so the picture of the hands, and they are turning somewhat black, and they ask you which of the following is the diagnosis. So in the question, if there are terms like he is a male and he is a smoker and his age is less than 40 years, then go for Burgess disease, because it is most likely to occur with the smoker. And another important thing which you must cover in this Burgess disease is the Boyd's classification, and this question was asked in the recent Jan 2024. So the question was asked on the grades, so do look at the grades. Then moving on, deep vein thrombosis. So the DVT, I think it is very easy topic, and most of them can crack the question based on the DVT very easily. So if it is a case, then features will be described like the female is on the OC pill or bedridden for a long time or long flight. Okay, like this, some questions features can be described in the question. And along with that, the clinical features like the pain, swelling in the calf region and calf tenderness. So if all these features are given in the question, then think in terms of the deep vein thrombosis. So one liner question are asked on this investigation of choice for the DVT in relation with the surgery, and the answer is the duplex USG. Then looking at some other important topics, that is the gangrene. So the two types of the gangrene, the gas gangrene and the Fournier gangrene. So the causative organism is asked on this, which is the Clostridium, and in the Fournier, mostly an image-based question is asked of the scrotum. And as we all know that it is a infection mostly involving the scrotum, and it is polymicrobial, that is more than 2 organisms are involved in it. So look at the image of the Fournier gangrene also. Then moving on, ulcer, also a must do topic, because repeatedly questions are asked on this ulcer. The borders of the ulcers, like raised, irregular or everted edges, or there are rolled out edges. So image based question was asked on these borders in the Jan 2024. So do look at the images also. And the types of the ulcer, it is usually the squamous cell carcinoma, the basal cell carcinoma, malignant melanoma, and the Marjolin ulcer. Then along with that, you need to look at the arterial ulcer. The features of those, like the Marjolin ulcer, it occurs due to chronic long-standing ulcer, and it is not malignant. Then features describing the arterial and the venous, and their location also, like that there is an ulcer, a neuropathic ulcer, which is most common with the diabetic, and it happens in the sole area, whereas the arterial, it occurs in the shin area, and venous occurs mostly in the ankle area. So these were some important topics which you must cover from the general surgery. Now let's look at some systemic disorders. So endocrine disorders, the first, the breast. So look at all the points regarding the breast, because one question from the breast is also a must. So it can be either on the cancer or the fibroadenoma, the abscess, mastitis, or phylloids. So these are the subtopics which you must cover from the breast. So fibroadenoma, it is a benign and a mousy tumor which occurs most commonly in the young. Then abscess, lactational females. Okay, then there will be pain and heaviness in the breast, and there will be also discharge present. So this question is asked repeatedly, the abscess. The question is asked mainly on its management, and if there is drainage present, then you will be giving the incision and drain the fluid present. Then mastitis, which is also more commonly seen in the pregnant female, and the phylloids, which is also another benign tumor of the breast, and in this the tumor will look like a leaf of ocellated appearance. And the cancer, breast cancer questions are asked on the staging, so you need to look at the TNM staging and management of the each stage. Then moving on to another very important topic, that is the thyroid. So you can expect one question from the thyroid also. So questions are asked mainly on the cancer, the types of thyroid cancer. So there are four types: the papillary, medullary, anaplastic, and follicular thyroid. So there are some features which differentiate them from one another. So you need to look at them, and one-liners are also asked on this cancer. Then questions are also asked on the thyroiditis, that is the like the Hashimoto's thyroiditis, due to which there will be hypothyroidism. So look at all the points from the Hashimoto thyroiditis. Then there are other thyroiditis like the viral thyroiditis, which is also called as subacute. And then the next important topic from the thyroid is the Graves' disease. So in the Graves' disease, there will be hyperthyroidism, and the questions are usually asked on its management and asked in integration with the pharmacology, like the drugs, antithyroid drugs. And also questions are asked in integration with the medicine. So it's better this thyroid you do it with medicine and pharmacology, then it will be easy. That in one session only you will be completing this from all the subjects. Then moving on, thyroglossal cyst. So this cyst is a congenital, and this will be present as a cyst in the neck, and whenever there is infection of this, and when you do incision and drainage, then there is risk of formation of thyroglossal fistula. So image based questions are asked mainly on this thyroglossal cyst. Then moving on, brachial fistula. So this is also a congenital anomaly, and it develops whenever there is a connection or a fistula formation between the brachial arches. Okay, so the brachial arches, they are not developed properly, and due to persistence of any one of the duct, there will be formation of this fistula, leading to the clinical features. Okay, then moving on to the cystic hygroma, it is also a congenital disorder. So image based question can be asked on the cystic hygroma, and question are asked on the management, like you will be doing the surgical excision of it. So it will be cyst like thing present in the neck. It usually involves the lymphatic, and the most common site is the posterior triangle of the neck. Next, parotid tumors. So question are asked on the tumors, like the most common benign and the most common malignant. And this year also there was a question in the Jan 2024, that how do we treat it. So there was a tumor swelling in the parotid, and how do you treat it. So it was the superficial parathyroidectomy. So looking at the condition, you need to choose the management. And questions are mostly all asked on the two more common salivary gland tumors, like the Warthin tumor and the pleomorphic adenoma. Then moving on to the ranula. So image based question is asked, and it is also a very popular question, the ranula. So it is a swelling present in the tongue, in the inferior floor, and the question are asked on its management, which is the incision and drainage. And if it is recurrent, then we will be doing excision of the ranula. Next, mediastinum tumors. So this is also a very important topic, and questions are asked in integration with the medicine. So the mediastinum, it is classified into the anterior, the posterior, and the middle. So you need to look at the tumors, which tumor arises from which part. So mostly one liners are asked on this mediastinal tumor. So if you look at only those 4-5 points, then it is more than enough. Like the most common in the anterior, the most common in the posterior, in the middle. And also look at the organs, which organs are coming in the anterior, the posterior, and the middle. By looking at these few points, you will be able to solve this question easily. The questions are asked on the classification, that is the Todani classification of the choledochal cyst. So look at the images also, because image based question can be asked. And the management, how do you treat it. So the management is based on the classification, like if it is class 1, class 2, class types. Okay, so based on the type, we will be also providing the management. Then moving on, another very important topic, the congenital diaphragmatic hernia. So can expect a one question from this, because in all the paper a question is asked on this congenital diaphragmatic hernia. So in future also there are chances that a question can be asked on this. So be prepared for it. So the pattern of the question is like image based, clinical case, one liner. So anything can be asked on this. So look at the image, also the chest x-ray, and in the question there will be describing a child who is having respiratory distress, and in the chest x-ray you can see the multiple air fluid levels, suggesting that the small intestine has herniated into the chest, and there will be, and the Rayleigh tube, it will be coiling in the chest itself. So these were some points describing the congenital diaphragmatic hernia, and also there are the types. Okay, the Bogdalic hernia and the Morgagni hernia. Morgagni and the Bogdalic hernia. So look at the differentiating points of this also, that the Morgagni is mostly present on the middle or the slight towards the right side, and the Bogdalic present towards the left side. And another very important question which you must remember from the congenital diaphragmatic hernia is that the bag and mask ventilation is contraindicated in it. Asked many times as a one-liner. So these were some points which you must know from the congenital diaphragmatic hernia. Then the next topic, tracheoesophageal fistula. So question is asked mainly on the types along with the image. So image based question is asked. So do look at the images. So it is classified into various types like A, B, C, D and E. And the clinical features will be described like inability to put the Rayleigh's tube. So the Rayleigh tube, it will be coiling in the chest. Then there will be frothiness in the mouth, and you need to look at the management. And it is also based on the types, like if it is type A, then you will be treating by doing esophagectomy. Then in type VCD is esophageectomy, and in the E there will be formation of the fistula in the E, so you will be removing the fistula and closing the defect. Then moving on to some next important topics like the pyloric stenosis. So the congenital hypertrophic pyloric stenosis, this is also an important topic. So in this condition there is hypertrophy of the muscle, due to which there will be obstruction, and the food is not able to pass into the intestine. So questions are asked on its investigation of choice, which is the USG, and also on the management. Then pancreatitis. So clinical case are asked usually on the pancreatitis, and acute and chronic. So if it is acute, then it is mostly due to the gallstone, and if it is chronic, then it is mostly due to the alcoholic. So look at these features in the question, and along with that there will be clinical features describing that the pain, it is radiating to the scapula or the back, and the serum amylase and the lipase, these are increased. Then moving on to the liver abscess. So there are the types of the liver abscess, like the pyogenic liver abscess, then amoebic liver abscess, then the hydatid cyst. So questions are repeatedly asked on this hydatid cyst. So look at all those points of the hydatid cyst, the images, and there are various stages. Like in some stage there will be simple fluid collection, and in the type 2 there will be floating membrane. So look at those images also, and a very famous ultrasound finding of this is the water lily sign. So repeatedly image based question is asked on this water lily sign. Then next, acute cholecystitis. So usually clinical case is asked on this, describing a fat and a fair woman, and she is having pain after eating the food, fatty fried food, and in that the Murphy's sign is positive. So whenever you find the Murphy's sign in the question, go with the acute cholecystitis. And if they want to ask the one-liner, then simple one-liner are asked on the investigation of choice or the management. So management will be the cholecystectomy, and investigation of choice, USG. So don't confuse between the question, the investigation of choice, and the gold standard. The gold standard is the HIDA, but the investigation of choice is the ultrasound. Then next, gastric cancer. So questions are asked on its types, classification, the stages mostly. Okay, so which stage it is. So do look at the stages and the management. And the types, adenocarcinoma or the squamous cell carcinoma, and also the factors which differentiate them. Then moving on to another very important question, that is the Hirschsprung's disease. So this is a disease of the large intestine, the colon, in which there will be absence of the nerve plexus, due to which the contents, they do not pass further, leading to obstruction, and then the colon, it gets dilated. The questions are asked on the investigation of choice, which is the manometry, and the biopsy, and the management. Then let's look at some important esophageal disorders like the eclasia cardia, in which there will be the hypomotility, there will be dilation of the esophagus. So do look at the pathophysiology also, and look at the clinical features, and if they give it in a case, then there will be describing the features like the regurgitation of the food, then dysphagia, and mostly it happens in a young patient, so the young females will be given. An image based question are also asked, in which you will be looking at the barium swallow. Okay, the barium swallow image will be given, and the esophagus, it looks something like this, so the bird beak appearance or the rat tail. Then moving on to the Barrett esophagus, it is a malignant condition, pre-malignant condition, in which there will be transformation of the uh, esophageal cells from the squamous cell to the intestinal metaplasia. So look at the investigation, which will be the biopsy, endoscopy plus biopsy, and the management. And the risk factor is the GERD, uh, which is a regurgitation disorder. So in a patient with chronic GERD, this can be a risk factor. Then diffuse esophageal spasm. It is a hypermotility disorder of the esophagus, in which the esophagus will contract very fast, and in the barium swallow you can see this appearance of the esophagus like this, which is called as a corkscrew appearance. So this image is also very important because it is repeatedly asked in the FMGE. Okay, so do look at the points regarding the GERD also, like it is mostly due to the LES incompetence, and the clinical features will be like the epigastric pain, then burning sensation, and reflux and dysphagia. So these were some important topic which you must do from the esophagus. Then moving on to the peptic ulcer. So peptic ulcer disease classified into the two types, right? The gastric and the duodenal. So you need to look at the features which describe the gastric and the duodenal, and also the management technique, and the questions are repeatedly asked on it complication like the perforation. If there is perforation, you can see a finding on the chest x-ray, that is called as air under the diaphragm, which is due to the pneumoperitoneum. And there is another very important complication, that is the bleeding. So these were some important questions asked in relation with the peptic ulcer disease. So GERD, we have already covered it. Then dumping syndrome. This is also a favorite question of the FMGEs. So dumping syndrome, the question are asked, mostly clinical cases are asked. So it is also two types, early and late. So look at the features which are describing the early and the late. Like, so the early dumping syndrome, it occurs within 10 to 30 minutes of having food, and it is mostly due to the hypoosmolar contents in the food. And these late symptoms, it occurs usually after the 1 hour of the having food, and it is usually due to the hypoglycemia. Okay. Then hernia, questions are asked on this hernia also, the types of the hernia, like the femoral, then the direct, the indirect, the inguinal hernias. Okay, how do they occur and which defect do they occur? Because for indirect inguinal hernia, there is defect in the extraocular muscle, and for the direct, it is in the transverse abdominis muscle. And likewise, there is the femoral hernia. Okay, and along with that, there are various types of hernia also, like the incisional hernia, then the umbilical hernia, paraumbilical hernia. So images are also asked on this, so do look at the images also. And another very important topic is the management of the hernia. We usually do it by mesh and close the defect. Remove the hernia, put a mesh and close the defect. So question can be asked on the complete mechanism of it, like there are various methods. One famous method is the Lichtenstein repair. Then acute appendicitis, this is also a must do topic, because every year a question is asked on this appendix also. So the question can be asked a clinical case, and if they give a case, then it will be very easy for you guys, because most commonly males are involved. And then there will be pain in the right iliac fossa, and they can be describing any signs like the row sing sign, then the obturator sign, then the Suvas sign. Okay, so look at those signs. So what do they describe? And the clinical features. First, we have discussed the pain, mostly in the right iliac fossa, and this pain can be migratory because it can go to left iliac fossa also. Then there is increase in the temperature, and also there is leukocytosis. So the Diagnosis of the appendicitis is usually made by looking at the clinical features. So it is a clinical diagnosis, and in this there are various parameters involved. And how do we do it? We do it using a score that is the Mantrel's score. So you need to by heart the parameters, the features involved in this, and also the points. Like for migratory pain, we will be giving 1 point. Then if there is nausea and vomiting, then 1 point. And if there is tenderness, 2 points. Rebound tenderness, 1 point. And elevated temperature, 1 point. Okay. So like this there are various parameters, and you need to give the score and interpret the score. Like for example, if it is 10 9, if the score falls between 9 10, then the diagnosis is certain that is the patient is having acute appendicitis. If it is 7 to 8, then there is likely that the patient might be having appendicitis. Okay, it is not sure, but he might be having. Okay, then if it score is between 1 to 4, then it is negative. Okay, and the management is usually the appendectomy, removal of the appendix, and if there is a mass present, then we will be doing symptomatic treatment for some days, and after that we will be removing the appendix. So that's it in this video, guys. So as there are a lot of topics in the surgery, I'm not able to cover all those points in one video, so I will try to post another video, part 2 video on the remaining topic. I will try to post the video soon, so watch that video also. Okay, so as you can see here that this list is very important, and first try to finish the topic from the surgery, these topics from the surgery, and then go towards some rarer topics. And also surgery is a vast subject, so one advice I would like to give you guys, that don't try to complete the whole surgery in a one go, because you will get tired and you will not be able to, because it is very vast subject. So try to break it, like while reading the surgery, go do it topic wise. Like first go with the general surgery, so you will need 1 day for the general surgery. Then after that solve the MCQ of the general surgery. Then after you finish a minor subject, do again surgery, and that this time plan it like doing systemic wise, like completing the esophagus, the esophageal disorders. Then after that going to the breast, completing the breast. So like this, break it into various schedules and then try to complete, so that you will be completing the whole course and you will not be also feeling bored. So that's it in this video, guys. Thank you so much for watching this video. So I have already posted a video on the important one liners from the surgery, so watch that video also. Okay, bye bye guys, thank you so much.